Is our Deputy Director, started working for HCCA in 2015, has a deep interest in self-advocacy and healthcare systems and the way people experience healthcare, which has developed over many years as she has supported family members needing treatments and care. I will now hand you over to Kate and stop talking to introduce our panel members.
Thank you, Michelle. It's lovely to be here. Thank you, everyone, for joining us. I haven't been introduced that thoroughly for a really long time. So we're here tonight to talk about self-advocacy. I love this topic. I guess until I started working here, I didn't really sort of think about self-advocacy as a topic on its own. And it took me a while to sort of realise that it's a skill set, being able to speak up for yourself in healthcare, and you can learn how to do it. And often as people going through the health system by ourselves or advocating for other people, supporting our families, we don't really realise that actually there's a whole body of knowledge out there about how to speak up for yourself in healthcare. There are people and organisations in our community who can help you learn how to do that. And so that was a bit of a revelation to me as somebody who has sort of advocated for my children and sort of looked after family members going through healthcare, to kind of realise that this is actually something you can set out to learn. And not only can you, but you really should and need to make the most of the healthcare that's available to you. And so understanding that you have a right to be in that decision-making space about your own care, it is for you and about you. And if you're not in it, well, who's going to be there sort of speaking up for you in the way that you might already speak up for others if you're a parent or if you take care of family or partners? While also kind of acknowledging that it's your right to sort of be part of that decision-making and influence. And to get the best outcome, you really do need to be part of it. But at the same time, it's often at a time where you're not feeling the best, and it can be quite a hard thing to do. So, as Michelle said, this first half of tonight is a panel chat. We've got two fabulous people, Dalal and Emma, who are joining us to share some of their knowledge and experience. We find that learning from each other is actually one of the most effective ways to share advocacy knowledge. And we hope that you'll all be part of that too as we go, dropping your thoughts and your tips into the chat as we go. So I think what I will do now is just introduce Dalal and Emma a little bit more, and then we'll get on to our questions. So Dalal is a mother and a member of our chronic conditions network that we run at HCCA, and Dalal has a daughter who was diagnosed with a rare genetic condition called SAT2. I knew I was going to mess this up. SATB2 associated syndrome. And Dalal, you can talk a little bit more about kind of what made you sort of get more into this advocacy space in a moment, if you like. But I understand that you went to an international conference about, I don't know if it was about the condition or about rare conditions more generally, and you met other advocates there and then came back to Australia and decided to sort of move into that space of supporting people with this rare condition here. So thank you for agreeing to be part of this chat tonight. And then we've got Emma Sharman with us too, and Emma is an ADHD and autistic advocate who's also a member of HCCA and has recently done our consumer advocacy training. And we hope that you'll be with us for some of our advocacy work in the future, with a special interest in disability and neurodiversity. We also have some tips that we might share from time to time, and some sort of things to say from a lovely fellow, Alan, who was meant to be part of our panel tonight but couldn't make it. His health wasn't the best, but he kindly sent us in a whole lot of thoughts that we hope to share as well. All right, so our first question is around, why does it matter? Why is self-advocacy important for people using healthcare? We didn't decide who was going to go first. Who wants to go first? Emma or Dalal? Would one of you like to jump in there? Why do you think it's important?
I'm happy to
Dalal,
go first if you'd like.
please do. And if you want to say anything more about, your own experience, please do that too.
I will do that, but then I'll ask you to repeat the question because
Sure. Go ahead.
So yes, like you mentioned, Kate, the reason as to why I've taken this step is because of my daughter Naomi, who was diagnosed with SAPB2 associated syndrome, and it is a mouthful. I don't blame you for jumbling the letters. So Naomi was diagnosed in 2017 with an ultra rare genetic condition. At the time, she was one of 5 in Australia, and internationally, she was one of 195 people diagnosed that we would know of. So, and the journey in brief, I guess, is on our a diagnostic odyssey as to find out more information to try and support our daughter the best way we can. We reached out to families overseas, and that entailed a trip to the US to see the geneticist that was doing a bit of a deep dive into research. And then when we came back to Australia, we as in my husband and I, we thought, this can't be it for our Australian families. And although we are a very small group, it does mean that we are somehow isolated. We're somehow alone in this path, and it's very much an unknown path. And I guess my husband and I wanted to make sure that other families don't go feeling that way. And so as much as we wanted to connect everybody and to feel connected and have a family, we wanted to make sure that health professionals also would understand a little bit more about this rare genetic condition. And then along the way, we met other fabulous advocates as well. Some of them are here and they represent organizations as well. So now I'm going to ask you, Kate, to repeat the question.
Okay, so we've kind of led in really beautifully to this question. So, there's been a bit in your answer already. Well, why is self-advocacy important for you and your family and for people generally?
Yeah, so I mean, whether it's you advocating for your own health needs and journey, or whether it's advocating on someone's behalf, it's really important to understand that your decisions, your input in your own healthcare is quite important. And advocating itself is a learning curve. So there are aspects of it where it comes naturally, and some aspects where you'll learn as you go on the process. It's important to always make sure, from our experience, to ensure that the person that does need the healthcare is always part of that conversation. So in our example of my daughter, who's almost 10, we found that it's really important to include her in the conversation as well. So the example of young Naomi sitting next to me and the doctor talking to me about my daughter's condition, whether neurology, cardiology, whatever it may be, I always try and turn around and say, well, what do you reckon, Naomi? How are you feeling today? And she's nonverbal. She does have an intellectual disability. However, that doesn't limit her from participating. And it also opens avenues to the healthcare professional to understand, okay, there is a way where I can communicate with this young person. And the mum obviously wants us to, include her in this discussion, and that's really important to me. And I also want Naomi to feel empowered as well. So self-advocacy and advocacy is quite an important tool to have when you're on your health journey. I hope that answered the question.
Yeah, absolutely. That was a great answer. And that point that you made, and we might get back to this a bit later, that including children, including people who maybe don't have full capacity, it doesn't mean that they can't be part of their own healthcare decision making, and especially if they have others around them who can support that input like you can. So thank you for that, Dalal. Emma, over to you now. Would you like to expand a little bit first, as Dalal did, about what brought you to advocacy, and then we'll get into why it's important?
Yeah, no problem. So I'm somebody who was late diagnosed as autistic and having ADHD. By late, I mean that I found out I had ADHD when I was 28, and it was a year later, when I was 29, that I was diagnosed as autistic. So I went a good portion of my life not knowing those things and not having that knowledge to be able to, advocate for myself from an informed perspective about what I was experiencing. And obviously that ties very much into healthcare in terms of those situations. When it comes to dealing with healthcare providers of all kinds, we're talking about people who are generally very knowledgeable, have done a lot of education and learning to get to the positions that they are. But their knowledge is more general in a sense that you are the only one who's going to have the experience and the perspective that you do of your life and your body and your health. And the decisions that healthcare providers make in an office, in a single appointment, these go on to affect you every single day. So by self-advocating, that means that you get to share your specific experience and your needs in a healthcare scenario, and add to the information that your healthcare provider is actually working with as well. So it's the opportunity that you have to impact the decisions that they're making, ideally for the better, and experience some amount of agency over the healthcare situations that you find yourselves in and the decisions that are being made about your life. As I said, I'm somebody that's late diagnosed. If I hadn't done my own research, found out information about ADHD and autism, the different ways that they present, then I would still be struggling along with the difficulties that caused for me not knowing. Because if it was just a matter of letting the professionals know everything, then none of them had seen what was happening with me. And so I had to go through the process of saying, well, this is what my experience is. I want help. Please help me. And if it's also just a matter that our healthcare systems are really under-resourced, really impacted in a lot of different ways, I don't doubt that there's so much that healthcare providers would want to do to help people, but they can't do everything. So you do need to be a part of that conversation in all the ways that you can.
Thanks, Emma. And yeah, you made some really good points there about research being one of the ways you can actually support your own advocacy with healthcare providers. And that idea also that sometimes we might feel intimidated a bit by the, say, expertise of medical professionals, but it's really important. Like, they may have training in a particular condition. They have a lot of experience. They are experts in their field, perhaps, but we are experts in our own lives and our own bodies. And it takes both of those kind of expertise to actually come to to perhaps the best path forward. So I think that was really well made, that point too.
There's a really nice quote from Alan where he says, self-advocacy can mean telling them we don't understand what they're saying to us. It can mean telling them we can't read the sheets of instructions that they give us. And it can mean telling them that we're afraid. So I think the point he was making there was like, you can be as communicative and educated as you like, but when you're in that situation, it's not always easy to understand what they're saying, and self-advocacy can be about standing up and saying, I don't understand.
Yeah, and having that courage to sort of let that be known. I mean, there are lots of different parts to self-advocacy, but you've mentioned a few of them there, Emma. Thank you. And you also have answered a little bit, but would you like to get a bit more into why you think self-advocacy is important? Well, you've said it about yourself, but perhaps for us generally.
I think that basically everyone is going to be interacting with healthcare is going to need healthcare at different points. And even if you think that maybe you don't have a whole lot of needs to do self-advocacy at this point in your life, it's good to build those skills and that health literacy before you need to know how to do it. If it's for yourself, a friend, somebody that you're caring for, being informed, knowing how to do the research, get information that is needed. The number of people who don't know about self-advocacy until they're in the thick of it, and the need to do that until they're actually at a disadvantage because whatever has occurred has reared up and is removing your capacity to self-advocate or to do all of those things. You're not generally put into a healthcare situation where it's like, okay, in 6 months this is going to happen, so take this 6 months to prepare to self-advocate, to learn how to do that process. So I think for everyone, whether you feel like you are needing to advocate for somebody at this stage or not, you'll need those skills at some point. And so like learning the process and learning how to communicate needs there it's just going to be important for everyone at some stage.
Yeah, and often we do need those self-advocacy skills at the moment that we're having the crisis as well. And it's incredibly difficult to sort of both learn how to do this while also learning perhaps new information and being quite unwell, or quite in crisis. So it's really tricky. And I guess another thing you can do for self-advocacy is to have support, to have someone there to help you. And often we learn how to do it by being support for others as well. But it's kind of one of the tips if you can, and it can be anyone that you feel is a good person to have by your side there. But seek support for that advocacy. Thank you, Emma. All right, so this next question is around an example, and it's sort of a bit of a two-part question. I'll read both the parts, but then we'll kind of, I can repeat the questions. So this one, it asks for an example of a time that you needed to stand up for yourself, or maybe someone else, in using healthcare. And then following on from that, what was the outcome and what did you learn? I see you took yourself off mute, Dalal. Go for it.
Yeah. So I've got I could probably give you two examples of that one. One from a parent point of view, advocating on behalf of my child. And this was at the very start of our journey with Naomi. Naomi was, cute little girl. So many doctors, when we'd come to them with questions or concerns, it would just be the normal conversation of, give her some time and she'll catch up. Don't compare. And I'm pretty sure a lot of people have heard this. And so it had to be really guided by us as parents. And also she's our first, and we weren't really connected with other parents that were going through that journey at the time. So it was pretty much a learning curve for us as well. And it would entail a lot of, what should we do? Should we engage in therapy and see other specialists to help us understand as to why she's not talking, why she's not walking, and the list goes on. All her developmental milestones were quite delayed. And so we would keep getting these, phrases of don't compare, wait for her at her own pace. And so it really meant that we would have to do our questioning of other allied health professionals, for example. So we started taking her to therapy on our own accord. So we take her to speech therapy, physiotherapy, occupational therapy. And through the conversations then of, have you encountered any other kiddo like Naomi, who's had delays of, all of these examples of, and it became apparent that we would need to then engage with allied health professionals who would see children with quite profound disability to be able to help us navigate questions to ask or the healthcare system. So it got to a point when we realized that our current pediatrician wasn't the right fit for us. And so we needed to change pediatricians. And then our physiotherapist at the time said, why don't you ask about genetic testing? Now, no idea about genetic testing and what all of that entails and what all of that means. So we went ahead and asked the pediatrician at the first appointment, we don't want to waste your time or our time. Can you please let us know what is going on with our little girl? And is genetic testing something that we could do? So through that conversation, she was able to assess Naomi at the time, and she definitely agreed that genetic testing was something that's suitable. So we went ahead and did that. So about 8 weeks, and then a repeat of the genetic testing for her and hubby and I, which confirmed her diagnosis at the time of SATB2 associated syndrome, or GLASS syndrome, which is a gene variance within her second chromosome. That, yes, we had an answer, but it also opened up a whole heap of other questions and unknowns. So even at that point, we had to keep advocating to see specialists and why we need to see a certain specialist and what assessments did we need to take, what, examinations and tests and all that kind of thing. So we needed to then be the expert. And I think Emma mentioned this as being experts in our own healthcare, but we had to be experts in an ultra rare genetic condition that was, not really researched and not much known about. Then when we would show up to a specialist, we would send them whatever research papers we'd have, and we'd attend the appointment, and then we'd blurt all this information and then get told, you know what, I've never heard of this condition, but you seem like you're an expert. So I'm going to take your lead and you tell me what you want to do. And so we would say, we'd need a DEXA scan, or we'd need an MRI done, and we'd need this list of pathology assessments done, or blah, 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 blah. And then we'd get the whole, whoa, no, that's not what we do. Okay. So then it's like, okay, but you just told me I'm the expert, and I'm telling you this is what we need. So a lot of the time, we as parents, individuals, we have high respect for doctors. And as Emma mentioned as well, they're very well educated. They spent many years on their profession. And with all due respect, we had to conjure up confidence and a lot of prep to be able to, stand there and say to them, well, that's fine, but because of X, Y, Z, we need to have this assessment done so we can find out how to best navigate health for our child and improve health outcomes. So it was a lot of tweaking in our own personalities as new parents, finding new skills and new ways to communicate. So that's when Naomi was quite young. As Naomi grew up, and now she'll be turning 10 on the 15th of May, which is exciting and not so exciting all at once. There's new things that happen, new types of specialists, new diagnoses, new information that's coming up, and new things that's happening in her own development that we need some guidance with. So now the conversation has become, well, okay, when we see, for example, a cardiologist that needs to do an ECG for Naomi, they think it's appropriate for them to start taking off her shirt and start doing the exam. And I'm like, stop. That's not okay. And Naomi's quite scared and quite anxious. But she's been seeing doctors all her life. So there's a certain point in time where your advocacy changes, and it changes for reasons, either because of the need for specific expertise, or the environmental changes, or the person that's needing the health support or outcomes is growing up, like in this example. And so my conversation became, you need to make sure that you tell Naomi the steps you're taking into this exam. What can she expect from you? What can she do to help in the exam? And then what's the outcome? What's the machine that you're going to use? You need to talk to her as if she is me, because she is a human in her own right. And she needs to know what's going to happen. She's not a doll. She's not a baby. I am her parent. I am bringing her here because there is a need for healthcare. However, you need for her to participate, and for her cooperation, you need her consent.
Thank you, Dalal. Like, that's a really great, I can really see it's such an ongoing journey for you, but I can really see from what you've said that you know, things have changed for Naomi and for your family, but things have changed for you as well as an advocate. You know, your own confidence has developed through the journey, and your willingness to speak up. And, you know, from the beginning, when you had to be dumped into the role of an expert, when you really, you know, didn't know a lot either about this rare condition, you just knew a little bit more about the people who didn't know anything at all. So thank you. Like, I can really, yeah, that's a great example of how a person develops as an advocate, as well as how the journey changes. I'm sorry, I'm going to have to move on a little bit so we can get through our questions tonight, but we might come back if we have time. Emma, how about you? Can you give us an example of a time that you've needed to advocate for yourself or for someone else?
Yeah, I do advocacy work for my communities in the space of ADHD and being autistic, and sharing a lot of mostly like educational material to try and get people more acquainted with broader views of what those experiences are like. But something that would probably be perhaps more familiar with people is scenarios in which you are prescribed medication from a provider. And so in the example that I'm going to give now, I went to see my specialist about getting my script renewed for the ADHD medication that I was taking. And at the time, just to set the scene a little, changes had occurred to the PBS that basically meant that a long-acting medication that had not been available to a lot of people previously was now available in terms of being able to be prescribed it and being able to be prescribed it at a cost that was accessible. So this provider had probably seen a lot of people that had this same conversation perhaps with him, and had grown to expect that there was a lot of people that wanted to move on to this medication that hadn't been available. And in our appointment, when I said that I needed to get a new script, he then began writing me a script for this medication that I'd never been on before. He assumed that I would want this long-acting medication, that it would be easier for me because it would cover a longer period of the day, that I wouldn't need to worry about how often I was taking it or think about it. But he assumed that these were things that I wanted, and started writing me a script for a different medication. And I had to interrupt him, and I had to say, I don't want you to write that script. I don't want to change the medication that I'm on. I'm very happy with the medication that I'm on. It's working for me fine. I don't want to go through the rigmarole of trying a new medication when I don't have an issue, potentially finding an issue or a side effect or an adjustment that needs to be made to that medication in order for it to work to me. Figure out how on earth to get another appointment with a specialist, because it's always a specialist that you have to see if you're going to have changes to your medication. And go back and forth over this scenario. Please leave me on a medication that I'm used to, that I am aware of what the side effects are, that I can manage, and that honestly I prefer, because the short-acting type of medication that I take allows me flexibility in the length of time that I am under the effects of that medication, and whether I want to be on it for nearly as long in a workday versus, the odd chance to sleep in, and maybe I don't want to have to be on it for as long on a weekend if I have that flexibility. And so I had to interrupt this person and say, please stop writing that script. Please write the script that I've been on for years now, the exact same amount, the exact same medication. I do not want that other script. It does not suit me and the way that I live my life. And so he listened. I can go into that a bit more, but it's something that a lot of people would potentially find confrontational. To have to say to somebody who's meant to be an expert in their field and understand all of these things and who is your specialist, to say, no, I want this. I want this for me. This is the thing that would support me the best. Please support me in a way that allows me to live the life that I want.
Yeah, great example. And, I think it's that thing where sometimes when we have those interactions, the medical professionals, they're acting, in what they think is in our genuine best interest. They do kind of think that what they're doing is what's best for us, but they don't always check. And but then for something like medication, it can be very complicated. And it's one of the places where healthcare often goes wrong, or often doesn't go as well as it might. It can be quite difficult to advocate in the medication space. But if it isn't broke, don't fix it. Because it can be a hard thing to get right. So thanks for the example, Emma. Again, it kind of sounds like Dalal, you found the confidence to sort of speak up and say, no, that's not what I want. I need something different to that. Is that kind of confidence something that developed for you over time, or is that something that you haven't had too much trouble with?
Oh, I wish I could say I never had trouble with confidence. I still do in certain parts, but I find I have more confidence in advocating for my kids than I do me.
Well, I was going to say that actually quite often it's easier for us, especially if we're parents, or a partner of someone. It's sometimes easier to advocate for someone else than it is for your own self. And I was thinking, maybe some good advice in that space is, if this was your best friend that came to you, or if this was your child that came to you with the same problem, what would you tell them, or what would you tell a healthcare professional on their behalf? Emma, it sounds like you do this with and for perhaps other people in the community too. That must be, really fabulous to kind of have you there to be that support person. Okay. Is there anything, Emma, you'd like to add about what you've learnt from advocating for yourself?
In the framework of the specific experience that I spoke to just then, it confirmed for me that that healthcare providers, they can and they will make assumptions, and they will act on those assumptions. And it doesn't necessarily mean that those actions are like intended malice or anything. Sometimes they come from ignorance. Sometimes they come from just honestly not having enough time in an appointment and assuming that here are the steps that you came here for. Let me execute these as efficiently as possible. And so if you don't find a way to stand up and self-advocate for yourself in those scenarios, they won't necessarily know that their decisions are going to impact you adversely, because they're there for the session, the appointment. They might have reports and records and things like that, but they're not there when it actually impacts the way that you're living your life on a daily basis. And so it just drives home that you can have an impact, like you can have an impact on the information that people are working from and the decisions that they're making from you in the healthcare scenarios by speaking up. You don't always manage to impact everything, but if you don't try, then whatever pathway, whatever decision making that a healthcare provider was going to do without your input, will be made. You know,
Yes.
that decision will be made, and so you can at least attempt to influence that by saying what you need.
And feeling and actually being more in control of the situation is really good for your mental health when you're managing, you know, something that's hard or complicated. So, yeah, absolutely. Michelle, there was another example from Alan that had to do with medication, and I quite liked that, where he stood up for someone else. Do you want to just tell us about that?
I'll read it. He says, when I was in hospital waiting for my last heart bypass, I shared a room with the man who was a well-educated engineer and a manager. He had good communication skills. However, he became extremely upset when the nursing staff broke open all his Webster packs and gave him his medications from their drawer system, and was not confident to communicate that this was a major problem for him. He was upset because his Websters gave him control and confidence in taking his medication. His wife was in the room visiting him, and I asked if they'd like me to talk to the staff, and they said they would very much appreciate it. I went and spoke to the ward nurse and explained the distress and what it might help if they showed him how their system worked to make sure he had the right medications. They were very grateful. And so what he says at the end there, which I really like the most, is what I learned from helping another patient in hospital is that self-advocacy doesn't require me to understand anything about the health system. It's more about simple, clear communication. For example, by politely explaining to the relevant staff that this man was upset and why, they responded by helping him. So, I mean, Dalal's case is a bit different because you had to become an expert, but you don't necessarily always have to know the whole healthcare system and everything to use those advocacy skills to help someone get a good outcome. So that was a nice example he sent in to us.
Thanks, Michelle. And that, you know, again, that sort of illustrates as well that, you know, that potentially that medication, the second medication system was okay too, but he liked his Webster pack and he needed to feel in control of what was happening to him with the medication. It wasn't so much about the care itself, but it was about feeling okay about where you were in the journey and how much control you had over it. And I think it's a very much overlooked part of healthcare, and why people find it hard to cope sometimes is that feeling of lack of control and lack of understanding. And sometimes if you're able to get a better understanding or ask professionals to stop and help you get that understanding or help you get back some of that control, they're happy to do it. They just haven't always understood that that's what's going on for you. So, yeah, it's just, again, it's that confidence to speak up, isn't it? Okay, so we're on to our last question now. And what I might do is, so this one's about your best tips for other people who are learning how to self-advocate. I might get you to do kind of one each, and then we'll throw it to other people who might want to jump in too, or if you don't want to speak, you could drop your tip in the chat. There are so many different good things that we can learn from each other. So, Dalal, what would your best tip be, do you think, or one of your important things that you'd say to other people about how to speak up for yourself in healthcare?
There's a few, but if I had
well,
to,
let's start with one, and then we can come back.
I'll pick one that might give a nice, well, one that's nice to keep in the back of your mind when it's a bit frustrating. So one that I've had to do a lot over the past 2 weeks for school holidays. I guess for us, it's been to make sure that we remember this young person, whatever the challenges that they might be going through, is that every little bit of success or every little goal that they accomplish is one that's celebrated, and one that we should just be overexcited about. I mean, for us, it might just be, you know, learning to pick up the tissue and ask for your nose to be blown. As simple as that, so, which has taken a long time to master. But that, for example, is a huge celebration in our home. And we make sure she knows that we are celebrating that exact thing. So I guess that's one tip to remember in advocacy.
Celebrate the wins.
Yep, the small things.
Thanks, Dalal. What about you, Emma? What's one of your best tips?
Document everything. Document everything. Make sure that records are being made by providers. whether that be of medications that they're giving you or medications that they're not giving you, and the reasons why, or tests that they do or don't want to send you for and what they're in relation to. I think especially with lots of records and things being stuck in systems of various practices all over the place, we're seeing some attempts with both national and state territory based records to sort of put things in one spot digitally, and that has its pros and cons. But I think that in especially in a self-advocacy space, if you don't have a record of what you've discussed, what's happening to you, what you're meant to be getting tested, or what you're meant to be trialing in terms of medication or not meant to be trialing, and the why behind it, then trying to remember the details, get actions taken because of discussions that are not recorded after the fact is really, really hard for everyone involved. And so I think if you have everything documented, and even sometimes in a scenario where maybe you're having a difficulty with a provider, requesting the documentation of something that they've rejected, saying, oh, I don't want to send you for this test, or I don't want to try you on this medication. Even just saying, can you write down that you don't want to do this, and can you write down why? It means that you're in a position to have them examine their choice as well, and maybe consider it, and maybe they're not even like engaging with it as closely as they would, and asking makes them think about it. But also it means that maybe they've got a perfectly good and valid reason, and it can be there to remind you, oh, we've tried this avenue, or this is contraindicated with this other medication, or whatever the purpose might be. Also, by having it written down, it means that you can take that information away and process it at your own speed, and understand it or do your own research, whatever might be needed. So documentation everywhere.
I really like that tip. And the last thing you just said about take that information away and process it at your own speed. Often when we're having a health interaction, we're feeling kind of stressed. We're a bit heightened about the whole thing. We're maybe not very well. And even though in the moment we think we might remember what the doctor said, or what the reasons were, or any other part of that interaction, the reality is we often don't. And so that documentation is so important to help remind us or jog our memory later. And that actually also reminds me of my favourite tip, which is write a list of your questions before you go into an appointment. Actually write a list in whatever way you do it. That's one of my favourite self-advocacy tips, because you think you're going to remember what it was that you wanted to ask, and then you get out of your precious appointment that's taken 3 months to wait for, and you've forgotten one of the main things or some of the main things that were important. Yeah, absolutely. And that's that kind of meeting of the training with the lived experience. And so one of, another good tip is then to, share information that you know about yourself and how your condition and how it affects you. Give as much information as you can to your health professionals, because every extra piece is part of that decision-making sort of mixture. And the more information you can give them about what it's like for you and how it affects you, the better you can sort of both come to a grind. Does anyone else have a tip for us to share?
My top tip is if you can take somebody with you, because in the moment, like you said, Kate, the stress can cause sort of the brain fog, and they're like, oh my God, what did they say about that thing? And if you have another person there who's a trusted friend or partner, or even an advocate or a support worker, they will often have a clearer recollection. I mean, the recording and all of the paperwork and all that helps as well. But if you can take someone with you,
yeah,
it can be really helpful.
If I could, I can't speak to too many like specifics obviously there, but I would say that where possible, communicating about needs before the appointment and what you're trying to get out of the appointment, or what they want, or to the degree that you can, and understanding that, and perhaps even having some kind of written document of, we don't like when these things happen, these things impact us adversely, we'd like to have assistance with reducing the impact of this. Some of those things where maybe they don't feel as much that they have to do direct discussion or relaying experience on the spot. So having some of the more personal aspects of that conversation before you get there, and translate that information into something written that can be given to the clinician, could perhaps stop it being from quite as overwhelming to have to process all of the feelings and all of the information on the spot.
Thanks, Emma. So trying to find sort of alternative channels perhaps to communicate that don't require that really confronting situation so much.
Using these skills and also getting other opinions and moving on if the fit is not right, I think, is what we've sort of mentioned so far. Does anyone else, Chelsea or Kate, want to chime in on that one?
I was going to say it's a key one, have second opinions, but acknowledging that not everyone is able, clinicians, there are not always, especially if you live remotely or regionally, it's not always possible to choose someone else to be your provider. But I think in general, as a principle, to exercise your choice about and find a good fit with clinicians who get you is a really important thing to strive for. We don't always have choice, but when we do, we should exercise it, because a lot of good healthcare is about the relationship you have with your healthcare team. And so that to the extent you can, choosing who those people are.
Yeah. I've heard it called voting with your feet.
Exactly,
walking away.
Exactly. But acknowledging, that sometimes you just have to make the best with what is available to you.
That's
true. And that's not easy.
I guess I would also add to that, particularly if it's, in a situation where you don't have the choice, say in a public hospital where it's whoever's on duty, not being afraid to put in those feedback forms or, call the feedback lines and things like that. Particularly, in those health services, we have to take them seriously. They do get escalated. So I wouldn't say to be too afraid of that, because unless we don't know what we don't know. So we're always willing to work with clinicians or have a relook at our processes and things like that if they're not what our consumers need. Because at the end of the day, we're here for you.
I think to remember, some of the things we're talking about here are personality-based problems that you might have with particular people. But the other thing to remember is that if you don't have to consent to any course of action. So, as the consumer, it is your choice whether to take advice or take a course of treatment or have the surgery or whatever the kind of treatment plan is. And you can, if you don't trust or feel that it's the right decision for you, or you're not sure, it's really okay. And you're absolutely right to decide not to do a thing.
That's really okay to take as much time as you need to read those forms or to discuss what they're talking about. Or 100% agree with you there, Kate.
So I think the humans are not very good at assessing risk. We are anxious and fearful creatures. And I think the only way that you can try and wrap your brain around a treatment that makes you scared is to look at the data and look at, how many people are treated, how many people are helped, what the outcomes for people are of particular treatment. And I think the world is actually full of people who haven't done a treatment because they're afraid. And that's okay. If you have too much fear to do a thing and your fear is, you you'd prefer to be in your current state, whatever that is, rather than, you know, because you're overwhelmed by the fear of doing a thing. I mean, this is my personal view here. I don't think you can necessarily get past that, but I think the only way to kind of help someone understand how much risk there really is to look at data, and potentially, I mean, you can talk to people perhaps who have experienced it too, but even that is not, you know, that's a single person's view or experience.
A massive thank you to everyone for coming. A massive thank you to our interviewees and to Chelsea for that wonderful presentation. I think I'm even going to sign up for the Take Control Live Well program because I want a care plan just for me. So I will email you all soon with all of this juicy, great links and information.